Good morning, this is Joyce Thomas coming to you from Orchid Bay, and we are in the Central American country of Belize. And I love to come down here 2, 3, 4 times a year, and actually anytime I can escape. Most of you are working on your RN coder programs at home, and I want to show you how easy it is to be in a developing country such as Belize and be able to actually do your work from literally anywhere. So when I tell you nurses find your beach, when I'm discussing that with you, I'm always thinking about Belize, thinking about Orchid Bay specifically, because you have an amazing opportunity right now to learn how to take everything you know how to do as a nurse, everything you've learned on the job, in school, everything you've learned and experienced as a nurse, providing patient care, working with physicians, clarifying orders, assuring that that everything that was done for the patient is documented. It has to be documented before it can be coded. So when you have a chance to work with a company like RN Coder Virtual Office, you are logging into a secure EHR. You are opening the task list and seeing that there are documents there that need to be coded, they need to be checked. You might see something that indicates to you that the physician changed the medication order. Well, nurses, why did he do that? That's what you would ask if you were on the floor, right? Why did you change the medication order? You may not, you actually may know what something's changed with the patient's condition. So when you are doing the documentation review, documentation improvement, and coding, you're actually, it's like an extension of nursing. You've already been doing this stuff for years. If you were in a situation where you were charging, that's actually a different name for coding. I don't know if you know that. So I want you to think about what you're going to be doing for the rest of your nursing career. You don't have to stop what you're doing to do this. You can do this on the side. And then later on, if you want to, you can do it more full-time. It's really up to you. It's up to your financial situation. It's up to what you want to accomplish. I've called this high-tech piecework for years. Our grandmothers took in ironing, or my grandmothers did sewing. My dad's mom, my grandma Lizzie, could literally look at a dress in a catalog or on a mannequin, and she could go home, she could cut a pattern out of newspaper, she could fit it, and she could create it. And she could do it all without any formal training or anything like that. That's just what she did. And she took in that type of work until she was really much older, because she had a couple of daughters who could do some stuff with her. When you're in an interesting country like Belize, let me walk around here and show you some of this really cool stuff. I'm going to turn the camera around here. We have all kinds of interesting situations. We have, somebody's got their sailboat here, just pulls it up on the beach. See how beautiful it is this morning? It is just absolutely gorgeous. And this is called the rainy season. Yes, it rains. It actually thunders and lightnings sometimes. But basically you see this most of the time. It's an even temperature. There's no wild fluctuations. And I'm telling you about Belize because it's really like the last frontier down here. Everybody speaks English. They also speak Spanish. They also speak Creole. They also speak other languages, but they mainly speak English. And there's our palapa and our dock. You see a couple of boats pulled up. And this is really unspoiled. Orchid Bay has been around since 2008, and it's kept really, really good. The casitas are always for rent. You literally can go on Orchid Bay Beach Club and see insides of the casitas if you wanted to. It's a great place to come. It's a great place to bring the family, the kids, the grandkids, hang out for a couple of weeks. It's safe. The kids can run around on the beach. They can go out several feet and not be... you don't have to really worry about them. You should keep an eye on them, of course. Got an infinity pool. So I really want you to think about this. Those of you who are getting towards retirement age, the nurses that we really like to Get the little bug out. The nurses that we really like to consider having them work with us is, we want you for your experience. We want you for your, what you already know how to do. We're just adding the coding piece and how to do the documentation review in a structured manner so that you don't miss anything. Because reimbursement is what we're talking about here. Reimbursement and reimbursement integrity. We're not talking about what the coders do in the medical records department. That's not it. This is substantially far above that. This is making sure that, remember, well, wait a minute. Remember they pounded into your head the, if you didn't chart it, you didn't do it? Okay, so I use that to train nurses in coding. If you didn't chart it, you didn't do it. Now you can't code it. So the problem is, especially as we've gone into ICD10, we seem to have survived it. But let me tell you, the denials are coming in. The hospitals have no safe harbor. Only the doctors have a safe harbor, and that's temporary until October 1st, 2016. So that's going to expire. So know that, yes, they're getting it done, but are they getting it done correctly, and are they getting it done so that the insurance companies can accept the coding? And here's what happens if the hospitals and the doctors don't submit correct ICD-10 codes this year. They're going to screw up their fee profiles and their case mix from now on. And that'll be okay with the feds. The feds will be paying less. And the insurance companies, think about that. We'll mess it up from now on. If the doctors and the hospitals don't do correct ICD-10 coding over the next 2 to 3 years. You are uniquely qualified as a nurse to do this work. You walk in with a skill set for documentation, medical terminology, and understanding of anatomy and physiology, of disease process, pharmacology. You actually know how to read a chart. Isn't that amazing? That you would use a nurse to do something that nurses do all the time? So think about this, nurses. When I say find your beach, I want you to find your independence. I want you to find your financial background. I really want you to find your independence and your control. You need to be planning right now for your retirement. I don't really care how old you are. The older you are, the more you need to plan, right? I'm not going to go through what my mother and my grandmother went through. I'm not going to allow other people to make those types of decisions for me. I'm going to be in a place where I feel safe, that I can be cared for, that I have, a nice house to live in, and I have people around me that can take care of me, that are not charging me $8,000 a month for not too much. That's what my grandmother went through. So I hope you consider working with our Encoder Network and our Encoder Virtual Office. They are two separate companies. Our Encoder Network has been a continuing education provider for nurses. We are licensed by the California Board of Registered Nursing since 2001. This is all we do, is we train nurses to do this. You can earn credit, you can maintain your license. Doesn't matter where you are, you can maintain your license with our Encoder Network. And then you can work for our Encoder Virtual Office. We work with doctors' offices, clinics, hospitals, inpatient, outpatient. Doing a little bit of home health, not a lot, because their payments and everything it's so structured, it's so different than fee-for-service. We pretty much are doing fee-for-service. Whatever it is, it's fee-for-service. So I hope that you will take this into consideration, that you can literally find your beach anywhere. You don't have to leave the United States, but it's kind of fun to be down here in an English-speaking country and then have a chance to work and play. I try to do about 2-3 hours of coding a day when I'm inside the casita and it's hot out there and I'm in the cool casita under the air conditioning, and about 2 or 3 hours of coding a day. And there's right now there's a little over 20 nurses doing that right now with us. They have to have full certification, AACCA. You can go to aacca.net for information. Certified RN Coder, ICD10, certified RN Coder, CPT. So I hope you consider joining us someday. Nurses, find your beach. Let's go. it's time.